Hi, my name is Roza Hirpa, and I'm going to be showing you how to do an IV medication administration via mini bag INT. I have been ordered by my physician to give a medication of vancomycin for my patient because he has a bacterial infection. I'm going to first verify my doctor's orders and check to make sure that I have the correct medication, the dose, the rate, and the frequency. I'm going to check and assess the labs and any histories or allergies that my patient may have. And I'm going to make sure that I know what the action is, what the route is, what the dosage is, so that I can educate my patient. The action of vancomycin is to inhibit cell wall synthesis so that the bacterial infection can decrease. My doctor has ordered that my patient get vancomycin for 1 gram over 6 hours, and the pharmacy has sent me the vial here, and it is for 500 milligrams. So I'm going to administer a total of 2 milliliters, 2 milligrams, I'm sorry. No, 2 milliliters, a total of 1,000 milligrams to my patient, and I'm just going to calculate my drop factor, and I already did that over here using my drug book, and it is going to be 8 drops total. And I would then check any contraindications that my patient may have, and I will also calculate the infusion time to make sure that everything is going to be running the way it's supposed to. I would then apply a label on my bag, and I would put the name of the medication, the solution, the date, the dose, the time, and then finally my initials. Okay, and then I'm also going to put the date and time and my initials on the tubing so that we are able to use this in a 24-hour setting. Okay, now I'm going to attach a needleless device to my tubing, and at this time I'm just going to wash my hands and apply my gloves, and I'm going to clean off my vial, and I'm just going to get my saline solution ready so that I can clean off my patient when I get into the room. I'm just going to have 6 milliliters ready. I'm going to aspirate 6 milliliters. Put the air in. Draw up the 6 milliliters. Okay. Throw that in the sharps. So now I have my normal saline that I'm going to be using to clean off my patient's IV. And now I'm going to draw up my medication of vancomycin. And this is another vial of vancomycin. I'm going to clean off my top. I'm going to get my syringe. And I said I was going to pull up 2 milliliters. So I'm going to draw up, aspirate 2 milliliters. Okay. I'm going to put the air into the vial, aspirate 2 milliliters. Okay. And now there are 2 ports. I'm going to put it in the yellow one. I'm just going to clean that off with an alcohol swab to make sure that it's clean, wait for it to dry. And then I'm going to administer my medication. Okay, sharps, throw my needle in my sharps. Then I'm going to just gently shake the bag to make sure that the solution is mixed in. Okay, now I am going to pop this tubing open, and then I'm going to, keeping my my tubing sterile, I'm going to open up that, throw that away. I'm going to attach it to my tubing using a seesaw-like motion. And then I'm going to make sure that, sorry, excuse me for a second. I'm going to make sure that it is clamped off in the beginning. And now I'm going to see if it can prime. So I'm going to unclamp it. And we should see it running. And it is. Okay, now I'm going to clamp it off. And now I'm going to put that back on my tray to take into the patient's room. So now I have my 6 milliliters of saline ready. And I have my tubing ready. I have my alcohol swabs. And I have my gloves to take to the room. So then I'm going to walk into the patient's room. Okay, I'm going to identify myself. I'm going to identify the patient using 2 identifiers. I'm going to ask for any allergies, how the patient is feeling. I'm going to explain the procedure. I'm going to then wash my hands. I'm going to reapply my gloves. And then I'm going to assess the patient's IV site to make sure that there's no phlebitis, that it's patent, and that I'm also going to assess for pain and heat. All right, and everything looks good. So I'm going to then put my 6. I'm going to put 3 milliliters of saline and into my patient's IV line. I'm going to make sure that it's clamped off to begin with. I'm going to put that in. I'm going to aspirate. Okay, I have blood return. I'm going to do a stop and go really slowly, and I'm going to push in and clamp it. I'm going to push in my 3 milliliters. And while pushing, I'm going to stop so that I have positive pressure and clamp it off. And I'm going to remove my saline again. I'm going to put it back on my tray. And now I'm going to attach my bag, which I've already clamped off. I'm going to hook it. I'm going to hook it onto the hanging tray. And now I'm going to clean off the site. I'm going to clean off the port. And now I'm going to connect my INT. All right. Now it's good. I'm going to make sure that it's still clamped off and it's underneath this. So I'm going to now I'm going to pinch this little tubing to make sure that I have my flow rate going. I'm going to now time my flow rate to make sure that it is 8 drops per minute. And it is 8 drops per minute, so I'm just going to let it flow. Okay. Now I'm going to make sure that I document the time, drug, dose, route, and the condition of the IV site, the volume of fluid that I used to deliver the medication, and the intake and output. And I'm going to also check my 4Ps before I leave my patient, which is his position, if he has any pain, if he has to use the restroom, and that his personal belongings are with him. I'm going to then come back 30 minutes later. I'm going to clamp off the site. I'm going to reassess my patient and make sure that everything is running the right way. Okay, and it seems like it is. Everything seems good. All right, my medication has run completely. So now I'm going to clamp that off. I'm going to unhook this, clamp this off so that it doesn't go back on me. Okay, and I'm going to hang it up. I'm going to take my alcohol swab, clean that off, and then I'm going to take the remaining 3 milliliters of saline that I have, and I'm going to flush it again. Okay, I'm going to throw that in the sharps. And now I'm going to take my IV tubing, and that is how you do a IV mini bag insertion INT. Thank you.